turn the key on and press the foot switch for a shutter test. And then it says it's passed, sometimes it says it's not. You just have to turn off and do it again. So it goes immediately into the burst mode, and you can tell by the triple cooling. So you want to press the mode button here, and then it goes into the no cooling. Up here is the joules, it's per centimeter squared. And this is a cooling if you want to use the post. This is the temperature of the room, and this is target temperature. So we're going to use 41 degrees Celsius, so press target temp, and then arrow up to 41. Oops. And then set target temp, so press it again. And if you want to use the cooling, then you press the cooling. We always use 10, so you can go up to 10. But we're not using the cooling, so taking that off. And then joules, just arrow up. And we're going to use 8 joules. And then it's in standby now, so you just ready it, the ready button. And the machine tests itself, and then it's ready to go. Okay, so patient wears eye shields. Okay. And then I'm going to wear protective eyewear also. Turn to your left for me. So our target temperature is 41 degrees. So we want to try and reach the target temp. So we're going to go ahead and start now. And as you hear the beep, that's letting us know that we're reaching our target temperature. How's it feeling, Temple?
It feels fine.
It's okay. So we're just scanning along the skin, trying to reach the target temperature as we go along, trying not to overlap. Okay. And you can always feel the skin to see the temperature of the skin if the patient is comfortable. Should feel very warm, but not too hot. Then I always like to just kind of pull on the skin a little bit, just to be able to get in the wrinkles a little bit more to treat those. And the hand piece, I just lightly glide along her face. And depending on patient severity of laxity, acne, or acne scarring, depends on the number of passes that we do. We're going to do actually 4 passes today. And with each pass, the temperature of the skin does increase. So the patient may feel more heat, so just communicate back and forth with the patient. We use a scale of 1 to 4. 1 is warm, 2 is very warm, 3 is hot, and 4 is very hot. Should be feeling about a 2. But we do, depending on severity, laxity, acne scarring, anywhere from 2 to 4 passes. Dr. Key recommends 4 to 6 treatments to get optimal results, knowing that your best results aren't going to be seen to 4 to 6 months out. So we like to stack the treatments, 3-4 weeks apart, and then we wait, good probably 4 to 6 months. And then you'll start to see even more change.
It's not too much, but it feels considerably warmer on my nose than it did on my cheek.
Yeah, most patients are more sensitive on the nose. Thinner skin, the nose and the forehead. So you'll feel more, and also underneath the eyes too. Most patients say it's most sensitive on the upper lip, under the eye, the nose, and the forehead. I'm going to treat underneath the eye for wrinkles, so you just stretch the skin down. Sensitive area here, so the patient may feel more heat here. But she's doing pretty good. Okay, so our first pass we went this way, so this time we're going to go the opposite way. Well, how I like to treat it, just everyone has their own pattern, but I always like to treat, the cheek area, and then the lip and chin, and the nose and the forehead. Everyone has their own different pattern, but that's just my pattern, so I don't forget what I've done. But so we're going to start on the cheek. As you first start out, you have to heat the skin temperature up, so you may go a little bit slower with your first pass. And then with each pass, you can scan the skin a little bit quicker. I do 4 passes in one area, so 4 on the cheek, and then 4 on the chin, 4 on the lip, 4 on the nose. That way you're heating the skin temperature up continuously. That way it's going to keep that 41 degrees. Otherwise, you have to reheat it every time you come back. And then also you keep the handpiece perpendicular. You don't want it to have it up like this or like that. It needs to be pretty perpendicular to the skin, so you just follow the contour of the patient's face.
It feels like this side of my face got warm more quickly. Is that true?
Yes, because generally the left side of people's face is more sensitive. Yeah. Yeah, most patients just kind of take a nap when we do this.
So just asking, just for a moment, what are you feeling? Just describe for us. If you had you're feeling no coldness.
No, I'm just feeling it's like waves of heat across my face.
And is that very hot or just sort of pleasantly warm?
It's pleasantly warm. It gets increasingly warm, but it's never too uncomfortable.
And you've had no numbing cream put on?
No, no
Okay,
numbing cream.
exactly.
No,
The
absolutely.
reason we're not using the numbing cream is we want the safety of you being able to tell us how it feels.
Right.
We're delivering heat energy, and the safety becomes both that little feedback. So if the temperature's too hot, the laser actually won't fire, won't treat. But the other safety feature is if it's too uncomfortable, you simply tell us,
Right.
and we lower the energy. Now, you'll leave here today with maybe a little tiny blush pink, not much more to see than that.
Okay.
And it's this part, this laser here, is for treating acne suppression, acne scar repair, collagen tightening. But you know it's not the laser for treating your melasma.
Right.
Okay.
Right.
Just to understand.
Right,
that.
I understand.
Okay. So far, this is a fairly pleasant experience.
Absolutely.
Great. And you're part of the loop. So as we're treating, you're going to be telling Lorena 1, 1, 2, 1, 2, 3. Yeah, we don't want any force.
Right.
Okay.
Right.
Any other questions?
No, I've had this before. It's a pretty comfortable procedure. So.
Great. Okay. Now, the last thing I said was there are multiples. Okay. And number 1 and number 2, there is the delay. we're treating today, but we truly believe your best collagen response is oftentimes 4, 6, even 8 or 9 months out.
Oh,
Okay.
okay.
Reminding you again about that. Otherwise, let's carry on. Thank you.
Okay.
Thank you.